December 2022, it blew me out of the water. I was a very successful executive, traveling, doing conferences, and I saw myself, just traveling to the airport something is wrong. So I communicated with my PCP. Thankfully, I have a very good PCP team, and they assigned me some tests, and they gave me an echocardiogram. Echocardiogram shows that my heart percentage is at 10%. So next thing you know, I'm admitted to the hospital, and just fighting for my life.
When we're with the patient in a room, they're asking us a question. I need help trying to understand what I should do, how to protect myself. So we just need to answer those questions honestly and with the best science that you have behind you.
There are several major ongoing problems with COVID. I would say the most striking is that some patients don't recover fully.
You can't do what you were doing before. You can't pick up your 2-year-old. You can't do nothing. Let's play ball. You know what, Daddy cannot play ball with you. I am sorry. You gotta wear the defibrillator and take your medication, drastic change in diet, of course, not work. I haven't worked ever since.
There's a minority of patients that just don't return to health, and they're plagued by persistent symptoms. People have to leave their jobs. They can no longer fill the same role that they were filling in their families. They struggle even to carry out activities of daily living.
Before COVID, I felt like I was on the career path I had been working toward for the previous 20 plus years. I considered myself to be a musician. My brother and I put together a band, and we used to write a lot of songs. And I thought I would do that for the rest of my life. After my son was born, I wanted to have a job where I wasn't traveling as much. So my father-in-law said, "You need a job with banker's hours." So I went and talked to a friend of his who needed a salesperson at their bank, and they hired me right away. Figured if it didn't work out, I could always go back to music, but it worked out great. Everything seemed to be going along pretty smoothly. As soon as I received the diagnosis, it was almost like a switch was flipped. I ended up with double pneumonia twice in a very short period. I had this difficulty with thinking clearly or concentration, and that was persistent. It really started within a day or so of the diagnosis, and it sort of stayed. It didn't really go away.
We really don't have an understanding of the mechanisms of what's gone wrong, so we don't know how to correct it, and that's really problematic for patients with persistent symptoms after COVID.
As far as music goes, I couldn't really physically play the guitar properly anymore. I still can't. I couldn't write music because I can't remember the words.
It's a tough situation. There is a need for more people to practice in this area of medicine. There's a need for better training in how to provide effective care for patients with chronic symptoms. And we also need to conduct research so that we can answer these questions and develop new treatments.
The Massachusetts Consortium on Pathogen Readiness, MassCPR, was launched at Harvard Medical School in March 2020 to respond to COVID-19. Since then, we've grown into a robust network of scientists, clinicians, and public health experts preparing for future infectious disease threats.
There are not that many places where people can come together and share ideas and information freely. MassCPR is one of them.
Partnership with organizations such as MassCPR are really important, especially as we think about the future and what might be coming down the pike. To have laid that foundation will help be responsive to new threats.
I think that MassCPR did the heavy lifting there in terms of convening us all together and created these links and colleagues so that over time, even as COVID-19, the crisis kind of started to step back, new projects came to the fore. And now we're looking forward, thinking about new things.
The Warren Upper Foundation encourages collaboration. MassCPR just embodies the spirit of that collaborative effort that we wanted. And so this is one of the reasons that we funded it. It's a great program. It's right in our wheelhouse.
MassCPR is all about readiness, teamwork, and discovery. We study how diseases spread. We act fast by sharing data. We train the next generation of public health leaders, and we build lasting connections between science, medicine, and the people we serve. Together, we're not just responding to crises, we're shaping a safer, healthier future for everyone.
I'm not going to give up. I can't work, so I have lots of time available to participate in trials or studies, see if we can help people.
Well, I can't stop fighting, and I know my peers cannot stop fighting when volunteers that come in my door that are giving their bodies and their time for no benefit whatsoever just to help public health.
We were very lucky that during COVID, that after decades of research in the mRNA vaccine, it happened to become available. Right? But luck is not a strategy, so we need to be ready next time when there's a pandemic.
We can't forget that over 1 million people died during COVID just in the United States, and many more were severely injured and are left debilitated or incompletely recovered.
Of course, diseases happen, viruses evolve. I'm well aware of that. But as a community, we could be evolving at the same time too, with how prepared we are as a society.